Hello and welcome to Hadassah On Call, New Frontiers in Medicine. I'm your host, Mayan Hoffman. Heart health is deeply personal to me. My Zaidi, my grandfather, passed away from a heart attack at just 72 years old, a loss that profoundly impacted my life. He was someone that I was incredibly close to. My siblings were too. In fact, my older sister, Rachel, was so impacted by our experience that she became a cardiologist. Inspired in part, she says, by his passing. Like my bubby and my mom, both my sister and I are lifelong members of Hadassah. Every year during American Heart Month, which is this month, Rachel speaks about women's heart health on behalf of Hadassah. When we think about heart health, we usually picture things like cholesterol levels, exercise, and maybe even a little too much stress. But did you know your gut bacteria might also play a role? It turns out that trillions of tiny microbes living in our stomach could have a surprising impact on your heart, especially when it comes to a lesser-known type of heart failure called HFpEF, heart failure with preserved ejection fraction. To help us break it all down, we're talking to Professor Rabea Asleh, head of the Cardiac Insufficiency Unit at Hadassah Medical Organization. He's diving deep into how heart failure affects the body and why the gut-heart connection might be the next big thing in heart health. Whether you've heard of HFpEF before or you're just here to learn how to keep your heart happy, this conversation will be packed with insights you won't want to miss. So let's get started. Welcome, Professor Asleh. So you're studying how gut bacteria might affect heart health. What is the gut microbiota and how does it influence our overall health?
Yeah, so gut microbiota is the combination of different microbes that affect our health. It includes bacteria, viruses, fungi, and other microbes. And recent studies have shown over the last decade or more that the gut microbiota is important in educating our immune system. So it's important for the immune function and also for the interaction with the host to keep the cardiovascular, brain health, and other physiological activities. So over the last years, we have seen that different metabolites are produced by the gut microbiota, influencing the human health. So some are beneficial that can be important for reducing inflammation and disease processes, and others that can be harmful, including those that can induce inflammation, atherosclerosis, and heart failure.
Wow, it's actually so fascinating. You don't think about your stomach being connected to all of your organs, and here we hear that it's really impacting your overall health. Now, how does what we eat then influence our heart? Could changing our diet, given what you just said, help us to manage heart failure, God forbid?
Yeah, so the diet is important. We know that from the types of diets that we eat, we are what we eat, basically. So Mediterranean food, for example, is more healthier than Western diet, rich in fat and saturated fatty acids. So we know now that different diets can influence our health differently. So vegetables and grains and fish that are rich in omega-3 and other beneficial components can influence positively our health system, and others can produce or promote atherosclerosis, heart failure, and other diseases.
It's amazing. And it's so great to live in Israel where we're supposedly following a Mediterranean diet, though I think we can all agree that it's becoming more and more westernized over here. Now, I'm trying to understand a little bit more about what you do. There was a term that I came across when I was reading some of your research. It was HFpEF. What is that? Could you break it down for our listeners, particularly in relation to the conditions like heart failure? What is HFpEF?
So HFpEF or HFpEF is heart failure with preserved ejection fraction. It's a type of heart failure. This is a very common disease nowadays in the Western population specifically, because about half of patients with heart failure in general suffer from HFpEF. So HFpEF is a disease that develops in older populations,
in the elderly,
over 60s or 70s even, patients with more comorbidities like obesity, hypertension, more prominent and prevalent in women than in men. And this disease is basically affecting the heart in different way than the regular, what we know about heart failure, the reduction in the contractility in the pumping ability of the heart. So the pumping ability of the heart is preserved. This is what the name means, that it's preserved ejection fraction. Ejection fraction is the fraction of the blood ejected every beat. So this contractility and pumping ability is preserved, but the problem is in the filling pressures. So the heart becomes more stiff over time, and there's more fibrosis processes inside the myocardium that prohibit the blood from being filled properly, and the pressures are elevated in the heart and lungs. And this causes different symptoms, including shortness of breath, fatigue, loss of energy, swelling and edema, and other signs of heart failure that we know.
Wow. I mean, I've never even had heard of that. And it sounds like it's fairly common. Do you have any idea in terms of percentages when you say it's more common for women, like how much more common for women versus men?
So usually when we're talking about coronary artery disease, so it's more common in men, and this disease can cause more commonly the other type, the heart failure with reduced ejection fraction. In HFpEF, it's more common in women. So I think it's more 60-70% women versus 30-40% in men. And this is because of different factors that can influence women more than men, including hypertension, diabetes, obesity, and the hormone effects like postmenopausal effects that estrogen, we know that can have some beneficial effects on keeping the flexibility and reducing the stiffness of the myocardium. So this effect is eliminated after the postmenopausal period, and leading to more common disease in the woman population.
Now, HFpEF, if I'm saying that correctly, is that something that you could live with and manage, or is that immediately deadly if you develop that and is the trajectory looking not very good?
Yeah, so until last several years, there was no effective therapies for HFpEF. And as I said, it's a very prevalent disease. More than 50% now of the population have this type of syndrome or
50%
disease.
of the total population?
Yeah, of the total heart failure population.
Heart failure population,
Yeah.
Okay.
So if we're talking about United States, we're talking about 6.5 million people with heart failure based on 2015 epidemiological studies. So
And
I
it's
think
probably only gotten worse.
maybe more 7 up to 8 million individuals with heart failure. So 50% of that have the type of HFpEF syndrome. So until recent years, we did not have effective therapies for HFpEF, but recently we have a few effective therapies. One is the SGLT2 inhibitor, the drug that started for diabetes and then found to be effective in the general heart failure population, including HFpEF subtype. And in the obese HFpEF population, we have now just recent months studies about GLP-1 receptor agonists like the semaglutide and the tirzepatide that are effective in reducing weight and were found to be also effective in improving symptoms of HFpEF patients.
Are those the shots that people are taking? Is that
Yes.
what that is? Okay, interesting.
Yes, it's higher doses than the Ozempic or semaglutide given for diabetes. So instead of 1 milligram maximum dose for diabetes, it's up to 2.4 when we're talking about semaglutide. But there is another drugs, including tirzepatide, also a 1 week a shot every week given subcutaneously to reduce weight. And because obesity is very important in the development of HFpEF, about 70 to 80% of HFpEF population are obese or overweight. So the obesity is very important also in the development of the disease and progression of it. So these drugs, by reducing weight and fat around the heart, increase the flexibility and the response to filling of the heart, which improves the symptoms.
And are you seeing similar percentages of HFpEF here in Israel? I mean, you mentioned the Mediterranean diet. I know there's a very large percentage of the American population right now that is suffering from obesity. Israel's probably growing in that way, but I know you're a little bit less. I mean, how can you compare and contrast between the two countries a little bit?
Still, obesity is very common in Israel,
Yeah.
mainly in the low income population, elderly, due to the entrance of the Western diet and the effect. And we know the Mediterranean food is healthy, but not all people in Israel follow this diet. So, with the comorbidities and obesity, HFpEF is still a very common disease here. So, I think we still struggle with obesity. Up to 10% of the population are obese, but I think in the United States, specifically in different states, it's very common, even more common than Israel. Up to 25% of the population have obesity. So over the years, with aging of the population, together with the diet that causes obesity, the reduced activity, inactivity, sedentary life habits, this all affect the heart health and increases the risk of HFpEF development.
Sure. Now, what are some of the early signs of HFpEF? I mean, that people might maybe overlook that they didn't know that they had, and then if they did know, they could go see a doctor maybe before it gets too late.
Sure. So HFpEF has some alarming symptoms, but they are not specific because different diseases can cause these symptoms, but they can be alarming, giving the other comorbidities. And we need to think about heart failure as one of the diseases that can be presented like these symptoms. So this basically includes, as I mentioned before, shortness of breath, loss of energy, specifically with exertion. So people become less active because they are limited during physical activity or exercise. This can develop to more alarming symptoms, including swelling in the lower extremities, abdominal swelling, fluid retention in different places in the body, and also the effect on other organs because the heart pumps blood to every organ. And so extracardiac manifestation can be also important, such as, fullness of the abdomen, affecting the kidney. So more urination overnight, shortness of breath during lying flat. This is also a sign of lung congestion as well.
So, just the work that you're doing, I mentioned at the beginning, I asked this question about the gut microbiota, and I'm curious, does the work that you're doing, the research that you're doing on how the gut microbiota ties to heart health pertain also to HFpEF?
Yeah. So we have been working over the last few years on understanding the role of the gut microbiota on development and progression of heart failure, specifically heart failure with preserved ejection fraction, the HFpEF that I mentioned, focusing on the obesity phenotype, which is the most common phenotype of the disease. So we run different experiments. We conduct clinical trial as well as transitional to basic experiments. We established a mouse model with HFpEF that we can produce this disease mimicking the human one. And we can study the sequencing, deep sequencing and analysis of the gut microbiota in humans and in mice. And we do also fecal transplantation, fecal microbial transplantation, or FMT. We bring the microbiota from humans and we can transplant the microbiome or microbiota from humans to mice after extensive antibiotic treatment to eradicate the microbiome of the mice, as well as using germ-free mice to study the effect of the human microbiota on the disease in mice. So we can assess the severity of the disease and the response to different microbial composition on the animal model disease.
So, were you able to find any specific types of bacteria then in the gut that do have an influence on reducing heart disease?
So we have more than 1,000 strains of bacteria. So it's very complex to get into a specific strain, but we found a different and a unique signature of gut microbiota composition that has been alerted in the HFpEF humans.
Meaning that if you find that that strain exists, then you're more likely to have HFpEF?
Yeah. So alterations and changes in the gut microbial composition and function, what's called dysbiosis, can affect the disease manifestation, both in humans and in mice. So we can do the sequencing of this gut microbiota and get a deep understanding of these signatures and strains. So, for example, we found enterobacterial strains that produce and enhance the inflammation in the heart that has been overrepresented in humans with the HFpEF disease. But others also, the imbalance between bacterioids and other bacteria can also affect the disease severity. And
is it like chicken and egg? Like, do you develop HFpEF and then it impacts the gut microbiota, or is it vice versa? And give whichever it is, or if they work together, how do you then use that to help move toward treatment? So, for example, if you discover that somebody has this strain, which means they might be more likely to have HFpEF, are you able to change it in some way or treat them in some way in order to reduce the chance of heart failure?
Yeah, this is an excellent question, because finally we need to help these patients. As I mentioned, there are few effective therapies for this type of disease. So the purpose of these studies finally to do some manipulations on the gut microbiota to help patients to attenuate the disease progression and help relieving the symptoms. So we're thinking about different approaches. One approach is to try to find a specific cocktail of beneficial microbes that can be intensified through a pill that the patient can take, or it's more sophisticated and advanced method than total fecal microbial transplantation, because it's not pure as giving a cocktail of these beneficials as a pill. And the other thing is trying to do more deep understanding of enzymatic and metabolite-based therapies that can we administer to these patients to help improve the bacterial function and increasing the beneficial metabolites, reducing the harmful metabolites, finally to help increasing the flexibility and reducing the myocardial stiffness.
All of these treatments sound fascinating, very important, and certainly could be potentially groundbreaking. I do just want to take us back, though, to ask a little bit more about the baseline of all of this, which, as you mentioned, this tends to be something that is with people with obesity, diabetes. Why not get to the root of the problem and just not treat, but actually change people's lifestyles? Or are we just not able to do that?
Absolutely. I mean, this is very true, because lifestyle changes is very important. It's the prevention, the primary prevention, which is the milestone of treating individuals to prevent the disease and not treating the disease when it comes to be very severe. So I think lifestyle changes, including healthy diet, exercise, maintaining healthy habits and good weight, healthy weight, will reduce the risk of developing heart issues, including HFpEF.
Now, I've read a lot about probiotics, prebiotics. They're often discussed when it comes to potential tools to dealing with your gut microbiome or the microbiota. What role could these play in helping to manage the cardiovascular outcomes of HFpEF or other cardiovascular diseases, if at all?
Yeah, so the gut microbiota has been established as a risk factor when it's has the imbalance and the unhealthy maintenance. So gut microbiota can be manipulated, can be changed through different tools. So one of the tools is the probiotic, the healthy bacteria that can be taken, or the prebiotics, which is the fiber that feeds this good bacteria. This is the difference between probiotic and prebiotics. So this can be one of the things to deal and to give to improve the health of our microbiome or microbiota.
And
the other thing,
go ahead. I'm sorry. Please continue.
Yeah, the other thing is to do some manipulations. First, the most simplified approach is to do fecal microbiota transplantation, but this is a kind of general treatment that does not go specifically to the dysbiosis that causing the disease itself. So more sophisticated or specific treatments can help individuals by targeting the healthy or unhealthy microbiota, intensifying the healthier bacteria and preventing the metabolites produced by the unhealthy bacteria by inhibiting enzymes or giving healthy diet that can enrich and induce the proliferation and growth of healthy bacteria in our body.
And is that usually done by drugs or supplements, or are there dietary ways? Like I know for probiotics, we often talk about yogurts, or when we talk about prebiotics, like it's like fibers and drinks or supplements or foods high in fiber. I mean, is that what do you recommend generally? Does it depend on where you are in the stage of having challenges?
Yeah, it can be the combination of both. Actually, a probiotic and prebiotic can be healthy in different ways and finally can improve the health of our gut microbiota. So this can be a combination and depends on the disease itself. We can probably try to target specific bacteria. Depends on which bacteria is more prominent in which disease.
I know the work you're doing here at Hadassah, I mean, it sounds very groundbreaking. And to me, maybe I'm not worldly enough. Is this very unique or different than what we're seeing in other places around the world? Are there things that you're doing that are special to Hadassah?
I mean, we have special tools to do here at Hadassah. So Hadassah give us the opportunity to build this cardiovascular research centers and many projects focusing on the gut microbiota. There are other different labs in the world working on gut microbiota in different diseases, brain diseases, diseases related to inflammation in the gut, like IBD, diabetes, and other diseases. But at Hadassah, we have the opportunity to be unique in developing and understanding the role of the gut microbiota, specifically in heart failure and inflammatory processes in the heart. We have other projects focusing on gut microbiota role in myocarditis, including the development of myocarditis related to immune checkpoint inhibitors. These drugs are given to patients with cancer to inhibit and attenuate the cancer progression. But they have some side effects, including development of myocarditis that can be life-threatening in several cases. So we're trying to understand the role of the gut microbiota and the susceptibility of these patients to develop myocarditis after getting ICI therapy.
Well, so fascinating. Now, is there any potential for some kind of personalized version of this? I mean, there's a lot of talk about personalized medicine today. I think that's kind of been the shift, in the last decade. And when it comes to the microbiota-based therapies, is there a direction that you're taking this where this will become individualized in some capacity?
Yeah, sure. I mean, this is an excellent example of personalized medicine because we can target different therapies individually to each patient, tailoring the therapy based on the composition of the microbiota.
Of their personal microbiota.
The personal microbiota in preventing disease development and sequences of therapies like ICI therapy and preventing myocarditis when they are getting this type of therapies, and reducing the risk of heart failure development when they are getting some manipulation based on their own composition of the gut microbiota.
So, Professor, is there anything else that you wanted to add or that you feel that our listeners really should know that we didn't have a chance to talk about?
I think we should be careful about our health. I mean, we should maintain a healthy lifestyle to decrease the risk of developing diseases over the time. With aging of the population, we are more prone to develop specific diseases that were less common in the past, especially HFpEF, as I mentioned. Obesity is a very important risk factor, so we need to protect our health by preventing reaching obesity status, to maintain healthy lifestyle and doing sport, physical activity to reduce the risk of developing heart disease. So we are trying to help patients by understanding several mechanisms, including the gut microbiota. So I think the combination of healthy diet, healthy lifestyle changes, including physical activity and maintaining healthy habits and quit smoking or never smoking, is very important to reduce the risk of developing such a devastating disease with this effective therapies.
Wow. Well, Professor, thank you so much for your time today.
Thank you so much for having me.